Hello friends, welcome back to the channel PsychoTech Score 100%. In this video, I'm going to discuss about anxiety disorder. So let us start the video and understand what is anxiety. Anxiety is an emotion which is characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. Further, anxiety involves the anticipation that a future threat may arise. Some people with anxiety disorders usually have recurring intrusive thoughts or concerns, and they may avoid certain situations out of worry. They may also have physical symptoms such as sweating, trembling, dizziness, or a rapid heartbeat. Now, let us have a look at anxiety disorder. So, in general, for a person to be diagnosed with an anxiety disorder, the fear or anxiety must be out of proportion to the situation or age, inappropriate, hinder ability to function normally. So if any person have these two conditions, then he or she might be diagnosed with anxiety disorder. If we talk about types of anxiety disorders, so there are several types of anxiety disorder, including generalized anxiety disorder, that is GAD, panic disorder, agoraphobia, specific phobias, social anxiety disorder, and separation anxiety disorder. So now I'm going to discuss these types of anxiety disorders one by one in details. First of all, let us discuss about generalized anxiety disorder, that is GAD. GAD involves persistent and excessive worry that interferes with daily activities. While some stress and worry are normal and even common part of life, GAD involves worry that is so excessive that it interferes with a person's well-being and functioning. And this ongoing worry and tension may be accompanied by physical symptoms such as restlessness, feeling on edge or easily fatigued, difficulty concentrating, muscle tension, or problems in sleeping. Often the worries focus on everyday things such as job responsibilities, family health, or minor matters such as course, car repair, or appointment. So these are some points about GAD, that is generalized anxiety disorder. Now let us look at panic disorder. So the core symptoms of panic disorder is recurrent panic attacks, which is an overwhelming combination of physical and psychological distress. During an attack, several symptoms occur in combination like palpitation, pounding heart or rapid heart rate, sweating, trembling or shaking, feeling of shortness of breath or smothering sensations, chest pain, feeling dizzy, lightheaded or faint, feeling of choking, and numbness or tingling. Some other symptoms may be chills or hot flashes, nausea or abdominal pains, feeling detached, fear of losing control, and fear of dying. Because the symptoms of panic disorder are so severe, many people who experience a panic attack may believe that they are having a heart attack or other life-threatening illness and may go to a hospital ER. Panic attacks may be expected, such as response to a feared object or unexpected, apparently occurring for no reason. The mean age for onset of panic disorder is 22 to 23, and the panic attacks may occur with other mental disorders such as depression or PTSD. People may begin to avoid situations and settings where attacks have occurred in the past or where they might occur in the future. This also can create significant impairments in many areas of everyday life and make it difficult to carry out normal routines. Next is agoraphobia. Agoraphobia is the fear of being in situation where escape may be difficult or embarrassing, or help might not be available in the event of panic symptoms. The fear is out of proportion to the actual situation and lasts generally 6 months or more and causes problems in functioning. A person with agoraphobia experiences this fear in two or more of the following situations, and the situations may be using public transportation, being in open spaces, being in enclosed places, standing in line or being in a crowd, and being out at the home alone. The individual actively avoids the situation and requires a companion or endures with intense fear or anxiety. If agoraphobia remains untreated, it can become so serious that a person may be unable to leave the house. A person can only be diagnosed with agoraphobia if the fear is intensely upsetting or if it is significantly interferes with normal daily activities. Next is specific phobias. So these phobias involve an extreme fear of a specific object or situation in the environment. Some example of common specific phobias include the fear of spiders, fear of height, or fear of snakes. And the four main types of specific phobias involve natural events like thunder, lightning, tornadoes, medical, which consist medical procedures, dental procedures, and mental equipment. Animals like dogs, snakes, bugs, and situations like small spaces, living home, driving. When confronted by a phobic object or situation, people may experience nausea, trembling, rapid heart rate, and even a fear of dying. Next is social anxiety disorder. Social anxiety disorder is a fairly common psychological disorder that involves an irrational fear of being watched or judged. The anxiety caused by the disorder can have a major impact on an individual's life and make it difficult to function at school, work, and other social settings. Next type of anxiety disorder is separation anxiety disorder, and this condition is a type of anxiety disorder which involves an excessive amount of fear or anxiety related to being separated from attached figures. People are often familiar with the idea of a separation anxiety as it relates to young children's fear of being apart from their parents, but older children and adults can experience it as well. When symptoms become so severe that they interfere with normal functioning, the individual may be diagnosed with separation anxiety disorder. And the symptoms involve an extreme fear of being away from the caregiver or attachment figure. Also, the person suffering these symptoms may avoid moving away from home, going to school, or getting married in order to remain in close proximity to the attachment figure. In a survey published in the Archives of General Psychiatry, it was estimated that as many as 18% of American adults suffer from at least one anxiety disorder. If we talk about diagnosis and treatment, so to diagnose the anxiety disorder, the first step is to see your doctor to make sure there is no physical problem causing the symptoms. If an anxiety disorder is diagnosed, further a mental health professional can work with you on the best treatment. But unfortunately, many people with anxiety disorders don't seek help. They don't realize that they have an illness that has effective treatments. Although each anxiety disorder has unique characteristics, and most respond well to two types of treatment, which are psychotherapy or talk therapy and medications. These treatments can be given alone or in combination. So the cognitive behavior therapy, which is a type of talk therapy, can help a person learn a different way of thinking, reacting, and behaving to help feel less anxious. And medications will not cure anxiety disorder but can give significant relief from symptoms. The most commonly used medications are anti-anxiety medications, generally prescribed only for a short period of time, and antidepressant. Beta blockers used for heart condition are sometimes used to control physical symptoms of anxiety. So this was about diagnosis and treatment. If we talk about the conditions which are related to anxiety disorders, there are some conditions which are post-traumatic stress disorder or PTSD, acute stress disorder, obsessive compulsive disorder, and adjustment disorder. So this was all about anxiety disorders and its types. So in this video we have discussed about anxiety disorder, and the types of anxiety disorders, which are generalized anxiety disorder, panic disorder, agoraphobia, specific phobias, social anxiety disorder, and separation anxiety disorder. And also I have discussed about the diagnosis and treatment and the conditions related to anxiety disorder. See you in the next video. Till then, take care. Bye bye.